South Africans learned today that after considerable backlash, the government has expedited the process to procure vaccines for 1.2 million healthcare workers. The country will receive 1.5 million doses of AstraZeneca shot over the next 2 months from the Serum Institute in India. Well, for more on this, let's speak to Dr. Anban Pillay, Deputy Director General at the Department of Health for Regulation and Compliance. Dr. Pillay, this is indeed long overdue and yet exciting news.
Yeah, we've been battling to get stocks in, as we indicated, from September, engaging with various companies to access stock. And so we're very glad that the Serum Institutes eventually come through to sign up an agreement to supply us with stock in January.
Well, I suppose the word is that there was a lot of pressure put on government to make this happen sooner rather than later. You seem to suggest that there have been ongoing discussions in the background.
Yes, we've been, the president had indicated very clearly in his last address that we've been having bilateral discussions, even prior to the last president's address. So we've been announcing for several months now, we've been in discussions. These things take long. A number of countries are trying to access vaccines from the same suppliers. And so they're reluctant to sign up agreements unless they can be quite certain they can deliver on their stock. So we, unfortunately, are having to wait for them to confirm that. And so that's why we were slow to confirm this, because we want to make sure that it's firmly in our hands before we actually make any announcements.
So excitement aside, what are the processes that we can expect between now and the first dose arriving in the country?
Well, we signed off the terms agreement now, so we just need to finalize the details around the stock, the date that will be shipped, and when payment needs to be made, and those kinds of things. But those are largely administrative in nature, from our understanding, given that the terms agreement is now signed. And we would expect that they would confirm in the next week or so, I guess, the exact date that we can expect the stocks to land in South Africa. And then once it does, we would, by that time, have a plan in place about how we would start the program, both in the public and the private healthcare system for our healthcare workers.
Well, interesting that you speak about the plan. So obviously not in place currently, but in your mind, how do you envision this vaccination process taking place across the country?
So the plan is in place. We presented that on Sunday. Basically, what we have as the plan is we would be registering healthcare workers in our facilities, both in the public and private healthcare system. And when the stocks arrive, we would then dispatch those doses to facilities for the vaccination program to start across the country. We would like to do this in all provinces in almost a simultaneous manner. So we've established a national coordinating committee that would be responsible for the planning of the administration of the vaccine, the actual logistics process, as well as then the administration as it happens. And the private sector is working very closely with us so that we have one single system by which we would dispatch vaccines to various facilities across the country so that everybody would have access at about the same time to the vaccines.
Now, 1.2 million is not a small number.
Yeah, no, it isn't. And remember, our target is much bigger than that. This is just the first priority group. We're anticipating having more doses of vaccines coming in after this delivery, and I think in the next week or so we should be able to finalize additional agreements around doses coming through, so that we eventually get to our target in terms of covering all the vulnerable persons.
So between giving out the doses and obviously having to deal with the impact of COVID-19 currently, do we have capacity?
Well, we're currently dealing with the surge, as you can probably note, across the country. The Western Cape, the Eastern Cape, Gauteng, as well as KZN have had significant increases in cases. They're coping. I mean, there are days when they're obviously stretched, but I think overall we've done fairly well in terms of trying to respond to all the cases across the country. Yes.
Dr. Anban Pillay, thank you so much for speaking to us. Dr. Pillay assuring us that things are under control as soon as the vaccine arrives. Now,